Today we're going to talk about image acquisition for the aorta, abdominal. So initially you want to start in a trans approach, about 90 degrees to the abdominal wall surface, and so a little bit of pressure. And so typically you would start proximal, however you can start distal or in the middle. So you start proximal and you hold a little bit of pressure. You ideally will see the spine shadow here. There's your pulsating aorta. So you want to be able to freeze and measure at this point. But then also you can basically hold pressure and go down, following distally to the mid-abdominal aorta. You still see the large spine shadow. You can adjust your depth as needed. You can continue on distally until you see the bifurcation. And you can see it just bifurcates right there, a little bit of bowel gas in the way. There you go, there's the bifurcation. And so all I'm doing is holding steady pressure to get that bowel gas out of the way. And then lastly, you can do a nice sagittal view. So I usually turn my probe with the indicator towards his head in a nice sagittal longitudinal fashion. And you can see here the pulsatile aorta in long view. You also can freeze and measure that with your calipers. If you're having difficulty getting views because of bowel gas, you can hold steady pressure. That should clear the bowel gas up. The other thing you could do is you can approach it from the right side, patient's right, versus the patient's left to try to avoid that bowel gas. And then the last thing you can do, can you roll on your left side, is you can have the patient roll on their left side and do the same approach, just trying to get a different view of that abdominal aorta.